Welcome to Season 1, Episode 10 of the Home Health Care Today show. I'm your host, Dr. Cleamon. It's June. In June, gentlemen, we focus on men's health. There's a week dedicated to men's health, and the entire month is also dedicated to men's health. So this podcast is not only focused on men, but it's also focused on the caregivers of men, children, siblings, significant others who care greatly about men's health. We are joined today by Dr. Fathelrahman Ali. Dr. Ali is an internal medicine specialist in Dearborn. Dr. Ali completed a residency at Oakwood Hospital. He currently practices at his own office, F. Ali, MD, PLLC, here in Dearborn. Dr. Ali is affiliated with Beaumont Hospital, Dearborn, Wayne, and Taylor. Dr. Ali accepts multiple insurance plans. He is a board-certified internal medicine physician. In addition, Dr. Ali practices at Beaumont Extended Care Facility, Heartland Care in Allen Park, and Beaumont Skilled Rehab. Thanks for having us today, joining you in your office, Dr. Ali.
And thank you, Dr. Moore, for having me. And happy Father's Day to you, and happy Father's Day to your listeners.
Thank you very much, Dr. Ali. Dr. Ali, we're cohabitants of the same medical office building in Dearborn, the Monroe Medical Center. And we see patients come down the hall all the time to see you and see you working late at night, going back and forth to hospitals to take care of patients. Doctor, share with us a little bit about your passion for medicine, your focus on health and various specialties.
I graduated from the University of Khartoum School of Medicine.
Yes.
I practiced in Africa for about 3 years, and then immigrated to the U.S. After completing the equivalent exam, and I completed residency in internal medicine at Beaumont,
Yes.
which previously Oakwood, Beaumont Hospital and Medical Center. I was the chief resident for the internal medicine program.
Okay.
And after I completed my residency, I started practicing in the Dearborn area, seeing patients from in Dearborn and from West Detroit, and a diverse patient population.
Yes.
I'm very passionate about taking care of diverse patient population.
Mm-hmm.
Our area here in Southeast Michigan, and in this area we have all kind of patients from all kind of background.
Yes.
I also see patients in the inpatient setting and in the office and with extended care facility.
Yes.
I love to see patients and their families and take care of the whole family.
Yes, sir. Absolutely. Thanks, Dr. Ali. Now, growing up in Africa and then attending the university to study medicine, right? One of the first universities in Africa. You got to share with us a little bit about some of the challenges, the obstacles that you faced along the way, and then, Doc, how did you overcome some of those challenges and obstacles?
I think the career path may be a little bit more clear in Africa than here, because you go straight from high school to a medical school, which is a 6-year program.
Yes.
And then you have to finish 2 years more of internship before you can pursue a special line of specialty.
Yes.
It all depends on hard work and effort and how you can go through the high school to make it to medical school.
Yes.
The big challenge is after you immigrate to the U.S.
After you
That's
get
a
here,
different
yes.
Experience, yes.
Mm-hmm.
Just to adapt a new country and a new culture and to get started and get residency and training, that's a challenge.
Yes, indeed.
I think the big obstacle for immigrant is the challenge that we face here,
Yes.
not back home.
Okay, all right, indeed. And Doc, some of those challenges, is it a cultural adjustment to the States? Is it the structure and the programming of education or the expectations? What are just some of those differences?
I think the structure of the training programs
Yes.
I trained in Africa. And I went to school there. We know
Yes.
the British system. You can go there and get some internships and get observership. You can have people ahead of you,
Yes.
and you can get your foot in the door.
Yes.
Over here, it's a whole different structure.
Awesome. Okay.
They ask you for experience
Yes.
in the U.S.
Mm-hmm.
and you just came in before you can get into a training program.
Yes. Got it, Doc. All right. So it's June.
And there's very limited opportunities for international graduate. There is always few residency position.
So I was just going there, Doc, with it being June, as we're focusing on Men's Health Week as well as Men's Health Month, but it's also graduation, right? Graduation season. And I'm sure there's, student viewers that are aspiring for med school. Doc, what would be some advice for some of those students that are aspiring to do well and go to medical school?
First of all, I'm very proud. This week I have two sons graduating.
Yes.
They are younger. One is going to college this year.
Congratulations,
And
Doc.
one is going to high school. So
Yes. So stepping up from 8th grade to high school and then stepping up from...
I think for the younger student and for the younger generation my passion is to encourage them, and
Yes.
especially in my community and the community around me where I live and work.
Yes.
Even in my conversation with my patient, the younger patient,
Yes.
I always try to play a father role and say, this is what you need to do. I talk about the school, about
Yes.
home environment, I encourage my patient and the younger generation
Yes.
to study hard and work hard
Mhm.
and to get their opportunities and their share of the STEM programs.
Yes, the STEM. Yes, sir. Absolutely, Dr. Ali. As we shift from, the mentoring of the youth, and helping some of the patients with some of those, issues and challenges as related to environment, community, and, professionalism, let's shift to the health then. For men, right? What are some of those top concerns? 3, 4, maybe even 5 health concerns that men should be aware of at various ages and stages of their life?
I think I will start with maybe the U.S. Preventive Task Force guidelines and recommendation,
Yes, sir.
where they recommend all men need to be screened for alcohol, for tobacco use, and for intimate partner violence. We also need to screen for common conditions. With the recommendation screen for diabetes
Yes.
and obesity. Diabetes, especially in overweight or obese patient.
Yes.
Hypertension or high blood pressure in all patients 18 and older, every 3 to 5 years. And for patients 40 and older, every year.
Yes.
Regardless of their age, all sexually active men, they need to be counseled regarding sexually transmitted infection, and with recommendation for periodic screening for patients who are at high risk.
Yes.
We screen also our patient, especially smoker,
Yes.
one time screening for abdominal aortic aneurysm, which is dilatation of the abdominal aorta.
Yes.
That's recommended for patients 50 to 75 years of age, in men who is a smoker.
Yes.
There's also screening for lung cancer in a smoker. Now we have a CT scan, which is a screening for the lung cancer. That's also in a smoker. That's long for long period of time.
Yes, sir.
We have the regular screening for other cancer like colon cancer. Colon cancer is recommended for screening anywhere between the age of 50 to 75.
Yes, sir.
We have different modalities for screening. We have done invasive testing recently, and which is the fecal DNA, and we have the traditional colonoscopy. We have, other than screening, very important is the vaccination.
Yes, sir.
Vaccination for every individual with an annual flu vaccine. For certain individuals, an older patient, they need also vaccination for the for shingles,
Mm-hmm.
the zoster vaccine, vaccination for pneumonia.
Yes, sir.
And more importantly, at this time,
Yes.
the COVID-19 vaccine. I know it made a big impact with the vaccination program we have now. We have very few cases
Yes, sir.
of COVID-19. We have very few number of cases in the hospital right now.
Absolutely.
So it definitely make a big impact.
Yes, sir.
But we still have a segment of our population very resistant to the vaccine.
We do. Yes, we do. Yes, sir.
So my encouragement,
Mhm.
I can't say more than encouragement at this stage,
Right.
is for all men and for everyone to get vaccinated.
Yes, sir.
We don't know
Absolutely.
what's going to happen in the fall. We don't know if you're going to have a different variant of the virus. We all hear about the variant in India right now.
Yes, absolutely, doctor. Yes, sir. Quite an exhaustive list, doctor, for men to be aware of. The one, doctor, the one that I did not recall from your list, and you might have mentioned it. How about prostate? Prostate health screening.
Prostate health and screening, there's a little bit of debate about
Yes.
in the medical literature and the consensus from the American Cancer Society, the
Yes.
American Urological Society, and the U.S. Preventive Task Force.
Yes, sir.
In the past, we used to screen with the blood test, which is the PSA.
Mm-hmm.
It's no longer recommended as a routine testing, but it's still for men over the age of 50 or men who have high risk. They need to talk to their doctors
Yes,
and discuss the pros and cons of the test of the screening,
absolutely.
either to their primary doctor or to their urologist.
Yes, sir.
But we no longer recommend routine screening for the prostate cancer with PSA.
Okay, this is good, doctor. Good, doc. I'm gonna do my best to try to recap that list prior to our commercial, right? Doc, you mentioned alcohol, tobacco, in the intimate partner violence. Assessing those risks for men. You talked a lot about diabetes and obesity, hypertension and blood pressure screening, STDs, sexually transmitted disease, intervention and disease. You talked about abdominal screening for
The abdominal aorta, for the
abdominal
the
aorta.
aneurysm.
Yes, sir. So that annual visit, the abdominal aorta screening, also screening for lung cancer for men, colon cancer for men between the ages of 50 to 75. Yes, sir, doctor. Very comprehensive list here. Yep, you mentioned the fecal DNA colonoscopy for men as a part of that colon cancer screening. You brought us home with the vaccinations, right? Vaccinations for shingles, pneumonia, and a strong encouragement
For the COVID-19.
for the COVID-19 screening. Yes, and we just had the conversation there about a rather touchy topic for a lot of men, prostate cancer screening, and some of the latest research and developments there. All right, Doc, any other comment do you want to add prior to our commercial as related to men's health and some things for us to be aware of?
You see also in the among men and in online, there's a lot of advertising for low testosterone
Sexual
and
health.
testosterone replacement.
Yes.
The consensus now, testosterone has risk of increased cardiovascular and cerebrovascular diseases. It can increase the risk of stroke and heart disease.
Yes.
So it's recommended only for men who have real low testosterone and they have symptoms of hypogonadism.
Mm-hmm.
They're exhibiting symptoms.
Yes.
But just we know with men with age, testosterone decreased.
Yes.
We have other medication. We can treat men for erectile dysfunction, especially men with history of diabetes and
Yes.
hypertension and heart disease. So these medications are very effective.
Yes.
But we have to alert everyone that testosterone is available as
Yes.
a medication. It's available as a gel.
Yes.
It's available as a shot, as an injectable medication every 3 to 4 weeks.
Yes, sir.
But it's not without risk. It's increased risk of cardiovascular and cerebrovascular disease.
Absolutely.
So it's only recommended for certain patients
Yes.
with certain symptoms of hypogonadism or showing symptoms of low testosterone. It's
Yes,
not
sir.
just because of a low number.
Absolutely, doctor. So some of those late night commercials,
Yes.
some of those gas station
It is
advertisements
everywhere.
and packets. Indeed, doctor. Indeed. Dr. Ali, thanks for that exhaustive list. That was a 1 through 10 of health concerns that men should be aware of. We're going to go to a commercial.
As Americans, we're defined by our grit, our toughness, our excellence, and our multiculturalism. But here in Detroit and Southeast Michigan, we are battle tested. That's our advantage. We've been hit rather hard by the pandemic and other health challenges. Allow American Advantage Home Care to provide skilled home care services for you in the comfort of your own home. We are Joint Commission accredited and CMS certified. Call us today.
All right, once again, this is Season 1, Episode 10 of the Home Healthcare Today show. I am pleased to have the opportunity to sit here with Dr. Fathelrahman Ali as we uncover some of those topics and questions that are important to men and those who love men as related to men's health. Dr. Ali gave us a nice laundry list prior to our commercial about topics and concerns that men should focus on. Doc, one particular topic that we did not get to prior to our commercial break is related to depression and anxiety. I appreciate your recommendation, strong recommendation for men to get vaccinated, COVID-19 vaccine, and be prepared for the fall. But it's fair to say that the last year or so has had a devastating impact on Metro Detroit as we think about COVID. Doctor, how should men, in your opinion, men listeners and viewers of the podcast and webcast, and we're thinking about Father's Day right upon us here, how should men attempt to cope with depression and anxiety?
I know COVID-19 has a devastating impact over the last 18 months.
Yes, sir.
There's a lot of anxiety. There's fear of the virus itself.
Yes.
There's grief. A lot of people lost family members, lost a loved one.
Yes.
The area was hit specifically hard in the beginning of the pandemic in March and April of last year.
Yes, sir.
I know a lot of families. In my own practice, I lost a few number of patients. The anxiety and depression can stem from the fear, as I said, of the virus itself,
Yes.
the grief from lost one, the anxiety of losing income, losing jobs.
Yes, sir.
All that increase the risk, and we know there's a lot of reports
Yes.
that report increased alcohol consumption,
Absolutely.
increased illicit drug use,
Yes, sir.
increased domestic violence.
Yes.
Social isolation is a big factor. So
Indeed.
we tell our patients yes, social distancing, but it creates a social isolation. People staying in their homes for month and month
Yes.
without having any interaction with loved one or with anyone,
That's
and
right.
that creates a lot of anxiety and depression as well.
Yes, sir.
I have patients who suffer for the last year, but
Yes.
there's a lot of help. I
Yes,
think
sir.
most of our therapists
Mm-hmm.
and psychiatrists and psychologists now they're doing a virtual visit and they're doing virtual counseling.
Mm-hmm. Yep.
A lot of primary care physicians are doing that as well.
Yes, sir. Absolutely, Doc. So for the men that say, I'm a man, so I should be able to take it. I should be able to bounce back, right? How could we do a better job of encouraging them to say that, it's a tough time. Yes, Father's Day is upon us. Yes, you are facing some of those challenges, but seeking help does not decrease or diminish
Not at all.
your manhood.
Not at all.
Yeah, so it would be good for men to get help for not only themselves, but for those that they love dearly. Indeed, indeed. Thanks, Doc. You mentioned the social isolation, and due to the lockdown, there were a lot more patients who were considered to be homebound, right? And homebound status. In your professional opinion, doctor, should men consider home health care and even not just the skilled, but maybe even private duty home care to assist, in managing debilitating illnesses and
I think
challenges?
both men and women, everyone who in need or everyone who's homebound, they need some kind of help.
Yes, sir.
What's good about the home care is
Yes.
that you take the care to the patient in their own home, their own
Yes.
environment. That will help patients with mobility,
Yes.
with physical therapy, with occupational therapy.
Yes.
Not only that, communication is easier now.
Yes.
So in the past, you have to wait for a visiting physician to come and see the patient every now and then. Now every patient can be helped by their
Yes.
visiting nurse,
Absolutely.
by their family member. They can
Yes.
schedule virtual video conferences with their physician and providers,
Yes, sir.
and that can help to provide the care in their home environment.
Absolutely. Yes, sir. And it's encouraging. It's very encouraging, doctor, to see patients who are homebound. And I look out our office door, and months later, they're walking down the hall, coming to your office to see you because they've
And this
received
is true
care.
not just for elderly
Yes.
patients. This is for
Yes.
anyone after hospitalization, after surgery, after
Yes.
injury. We know that from studies.
Yes.
This can also reduce the readmission rate and reduce the impact on
It
hospital.
does. Absolutely, doctor. So as a skilled home health care provider, American Advantage Home Care, our goal is to get into that house 24 to 48 hours, after a patient has been discharged, and start to provide care under physician's orders to help patients to recover, rebound, or to better manage, chronic illness. So, yes, sir. Thanks for that add-on, doctor, about the benefits of home health care. Last question for you, Dr. Ali, and for
Yes, sir.
our listeners and our viewers. Are there any other resources, right? Clinics, specialists, or groups that you would recommend to male viewers out there and listeners in Southeast Michigan?
I think we are very blessed in this area.
Yes, sir.
And just in the Detroit area by itself, we have multiple healthcare systems.
Yes.
And we have thousands of physicians and providers and specialists.
Yes, sir.
I think my advice is to get that, to encourage patients,
Yes.
and to encourage people to seek the, access and to seek help.
Yes, sir.
But help is available
Yes, it is.
as long as people are committed and they are encouraged to do it.
Absolutely. 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 And Dr. Ali, are you correct?
And not just men.
Uh-huh.
I think it's a message for women to encourage men because
Yes.
most of the men in my practice they're brought in by their woman, by their wife,
The
and by
wife,
sisters.
daughter, sister.
daughters.
You go on to see the doctor.
Yes, sir.
Absolutely. So, Doc says there's thousands of patients. In fact, the National Provider Identification Numbers, every physician has an MPI. Every clinician has one. There's 37,000 MPIs registered in the state of Michigan. So a lot of doctors to choose from. I encourage you, if you don't have a primary care physician and you're in the Metro Detroit area, to consider our friend here, Dr. Ali, in the Monroe Medical Center. Dr. Ali, is there anything else that you would like to add before we wrap up?
No, thank you. Thank you for hosting this, and
Yes, sir.
good luck with what you're doing.
Absolutely.
And I really appreciate you and your crew. Thank
Yes,
you so
sir.
much.
Very good. Thank you, Dr. Ali.
Thank you, sir.
You're welcome. Happy Father's Day, sir.
You too.
Thank you much.